A crack in a side tooth may affect only the enamel or extend deeper, depending on the individual tooth. A dental professional carefully evaluates the crack to determine its depth and the most appropriate treatment. Some cracks affect only the enamel, while deeper fractures may require more extensive dental care. If conservative restoration is appropriate, the tooth is carefully prepared while preserving healthy structure. In selected cases, a tooth-colored restorative material may be used to reinforce and restore the affected area. The restoration is carefully shaped to recreate the tooth's natural form and function. The restoration is professionally set and refined to create a smooth, comfortable surface. The completed restoration is polished and carefully checked for appearance and function. Professional management may improve suitable cracked teeth, but treatment depends on the extent of the fracture. This video is for general education only. If you have a cracked or fractured tooth, consult a qualified dental professional for evaluation and treatment.